Imagine facing the most serious threats to healthcare access in decades, then realizing that the future of millions hangs in the balance. That's exactly where New York finds itself amid sweeping federal reforms and drastic cuts, and the stakes couldn't be higher for its most vulnerable residents. In this in-depth interview, Elisabeth Benjamin, Vice President and Managing Director of Health Initiatives at the Community Service Society of New York, sheds light on the federal bill that could reshape, and in many cases, diminish healthcare coverage across the country, especially in New York. This bill, often called the One Big Beautiful Bill, was passed in July by a Republican-majority Congress aligned with President Trump's administration. It proposes the most substantial overhaul of the nation's safety net in modern times, with provisions that threaten to push millions off Medicaid, eliminate Affordable Care Act subsidies, and restrict healthcare access for immigrants. The implications are staggering, and the pushback from health advocates across the country has been fierce. Elisabeth Benjamin has been at the forefront of healthcare advocacy for more than 3 decades. She helped develop New York State's no-cost Essential Plan, an initiative that provides free coverage to low-income residents, and manages programs that help individuals navigate the often confusing world of health plans, including the complex landscape of ACA options. During our conversation, she explained her daily routine, balancing work in policy, direct service, and community training, and painted a clear picture of her lifelong commitment to making healthcare accessible. Benjamin's story begins with the realization that regardless of whether someone is insured through a good union plan, living uninsured, or a new immigrant, the healthcare system is notoriously difficult to navigate. This insight led her to advocate for a system that supports patient navigators, trained specialists who guide people through their healthcare options. Her organization, CSSNY, operates a centralized helpline, trains community navigators, and ensures that everyone works from the same secure, HIPAA-compliant database, fostering consistency and quality in patient support. Her work is not limited to direct assistance. She also engages in impactful policy initiatives. For example, in 2012, she helped design the New York Essential Plan, leveraging federal funds to offer free coverage to those above Medicaid's income limits, or who are ineligible due to immigration status. In 2019, her policy efforts successfully resulted in 8 new laws aimed at reducing the burden of medical debt, limiting interest rates, banning liens on homes, and preventing medical debt from affecting credit scores. Before the ACA expanded Medicaid, New York's coverage options were limited, especially for single adults. The ACA was transformative, reducing the uninsured rate from nearly 12% to just 5%. Still, navigating the many available plans was complex, requiring dedicated support that her organization proudly provides. But that progress is now under threat. The Big Beautiful Bill, set to take effect in 2027, curtails many of these gains. It removes eligibility for non-citizens in the Essential Plan, imposes additional recertification requirements, and introduces work mandates, all designed to make coverage more difficult to maintain, pushing many people off health programs. Benjamin describes the bill as ugly, mean-spirited, and punitive, and highlights the alarming projections: a potential loss of health coverage for 1.5 million New Yorkers and an economic impact of up to $8 billion in hospital funding losses, with thousands potentially losing their jobs and, tragically, lives. Her strategic response is clear: seek delays and advocate for protections, especially for lawful permanent residents who are vital to funding New York's healthcare safety net. She emphasizes the importance of state-level action, including the possibility of Albany calling a special session to craft solutions for implementation hurdles. Amid this storm of policy battles, Benjamin's day-to-day life remains grounded. A native of Chelsea, she starts mornings peacefully at home with her dog and coffee, then goes to work, either from her local office or home, spending her days in meetings, drafting policy reports, and collaborating with advocates. Evenings are reserved for connecting with friends and unwinding with mysteries or international fiction. Throughout her career, Benjamin has combined international experience with U.S. legal expertise, founding New York's first health law unit at Legal Aid, and playing a pivotal role in landmark cases like Aliesa versus Novello, which cemented healthcare access rights for legal immigrants. Her work continues to be driven by a passionate belief that healthcare should be a right for everyone, regardless of background or income. Living through unprecedented setbacks like the Big Beautiful Bill fuels her frustration, especially when federal and state lawmakers seem content with patchwork solutions instead of striving for comprehensive universal coverage. She questions the viability of passing bold reforms like the New York Health Act, which aims to abolish private insurance in favor of single-payer system, calling for creative models inspired by other nations, including Switzerland, to achieve real progress. Looking forward, Elisabeth Benjamin acknowledges her age and the possibility of retirement, but remains committed to steering New York through these turbulent times, aiming to do the least harm and keep vulnerable populations protected.